much. So I hear the video played. Is that true? Did you guys all see the video? Usually they play the video right before me. It's a better lead-in, but this is just as good. So thanks for having me. It's really a pleasure to be here, and I'm glad that you guys all took time out from your busy days to show up here. It's always a pleasure to travel, and I especially love it when there's great food. And I took a little walk down Broadway and slipped into the sliding door saloon and saw some great people playing guitar, playing Johnny Cash with the Johnny Cash Museum in the background. It's the only place I can do that, so it's really great. So today we're going to talk about relationships. Amid so much of the change, so much uncertainty, so many of the things that people have been talking about today, I'm here to espouse the immense value of the oldest treatment in the history of our species, relationships. For 150 years maybe, we've been on a mad dash to come up with medicines and procedures and imaging studies and laboratory tests to treat all the diseases that you all know about very well. And we've done a pretty good job with it. And we have all kinds of systems in place to deliver those things, and they deliver amazing results. The medicines that cure diseases, the surgeries that are safe now that in past ages people were terrified to undergo, and the imaging studies that are space age. And it was funny, when I was thinking space age, we don't even think about space age anymore. We don't even notice. We sort of take for granted that we can see inside the bodies. And while those systems are amazing, and while those innovations are amazing, and the technologies that support them, namely the EHRs, really have done a tremendous good, there's more to do. And so we're going to talk today about relationships and how they're valuable, how they're important, what you need to do to promote those and to enable them, and we're going to get going. You may ask, why does Salesforce have a chief medical officer? Why does a tech company like this investing in healthcare? The cool thing is that we didn't do this, we didn't figure out, as a company, we didn't figure out what we did for healthcare. We figured it out because every one of these other industries, every industry you can think of, thinks about relationships. They really care. I'm a family physician, and in my training, we were told to do things that would help us relate better to patients. Write a little note on the side of someone's chart showing that you understood what their kids' names were, what their hobbies were. The old joke in family medicine is you can't take care of someone unless you know the name of their pet. But we found that in other industries, as a company, by delivering them the technology that they needed to connect with their customers or their consumers or citizens or members, we found we have a really good technology to talk about healthcare and to relate to healthcare. But I'm not going to talk about technology. This is about people. One note, I was talking to some folks in the green room from Wakefern. It's a grocery retailer, and he was talking about how much he cares about people. There's some other folks that you're going to be hearing more and more, and I think everyone's sort of talking about this thread of caring for people. So why do we care for people in healthcare? So let's talk a little bit about disease. Cancer, as we all know, is the #2 killer in America. If I asked you all to raise your hands for those of you that have contact with someone or personally experienced cancer or care about someone who has had cancer, almost every one of us would raise our hands. And rather than talk about how much cancer costs or the terrible amount of suffering that it causes, I want to start off positive. So we all know that certain things and decisions that we make in our lives can really have a huge effect on cancer itself. We all know that organizations like the White House are focusing on their moonshot. Precision medicine organizations are worried about genetic tests to figure out what's the tumor type. Life science, bioscience companies are coming up with great drugs that are targeting cancer and tumors and doing great jobs with it. But if we help people quit smoking, we'd take care of 90% of lung cancer mortality, 30 to 40% of all-cause mortality. With eating and exercise, some other simple things that can be changed, we can have a huge impact on cancer. Those things aren't really supported by the EHR. They come from relationships, social support, some of the things that Sean Duffy was talking about for Amada Health. Relationships really have the crucial role here. And it's not just cancer. When you look at Alzheimer's, this is a huge number, $236 billion. And you all know that it's not because there's some very expensive drug for Alzheimer's, because there isn't. There's no procedure for Alzheimer's, and there's no imaging studies that let us see Alzheimer's. The cost here is in decreased productivity, is in social support, is in the home support, and really the very close contact and very costly care that these folks need. And so treating Alzheimer's is not a matter of curing it. It's a matter of supporting the people with Alzheimer's, and even more importantly, the people around them that take care of them. Who knows how many of us will get it? Most of us have exposure to it in some form or another. So this is something that hits home. And as you know, CMS has projected that Alzheimer's care is the single biggest increase in their budget over the next 5 years. This is a huge problem, and we need relationships. By the way, those relationships need to extend outside the hospital and outside the doctor's office. Here's another use case, diabetes. I know Amato was talking earlier. We all know diabetes. Diabetes is one of those great diseases, if you can call it that, that really serves as a nidus or as a rallying point for a lot of the things that people talk about. Hugely costly, causes tons of suffering, the number one cause of kidney failure, blindness, amputations. It's really a big problem. I had a patient when I was practicing who showed up one morning with her little booklet. This was in the old days when we had booklets that people wrote down their AccuCheck numbers in. And she showed for a few days her number was super high. And I asked her what was going on, and she told me that she wakes up in the middle of the night and makes tamales and makes all this good food for herself because she can't sleep. She was a great cook. And she had been sort of reliving a trauma that she'd had, and because of the anxiety, she fed herself, and her blood sugar skyrocketed. Treating her was not a matter of giving her more insulin. It was a matter of helping her figure out what was wrong in her life. So again, you'll hear tomorrow from Blackbird Health, who's talking about mental health. And again, all of these things really revolve around relationships and connections to people, and it's really important. The good news is that for a long time, family docs like me were sort of operating in the margins. Psychiatrists and pediatricians and other folks that sort of had the mandate to take care of people and connect with them were doing it outside of the reimbursement schema. But now we know there's money there. Whether it's the money that's coming in the form of readmissions penalties or some of the other stuff that's happening, we all know there's finally a premium on doing the right thing. And I think what we can say is that those organizations that are better able at taking care of people for lower amounts of money, for building stronger relationships, and using all of that to have a bigger influence in the health of people are going to do better. And in fact, it's going to be pretty unlikely for organizations that don't do that to succeed. So how do they do it? How are they going to do it, or why are they going to do it? Let's talk about that a little bit. So let's first talk about the why. We all know that there are tons of pressures that are influencing healthcare right now. At the same time, by the way, that all these pressures are happening, medicine and healthcare is industrializing. We're not as fortunate as our colleagues in the automotive industry, manufacturing, or retail, or other folks that basically industrialized 100 years ago. We sort of are doing it now at the same time that we have these crazy pressures that are affecting all of us. So, regulatory pressures that are decreasing reimbursement. You see some of the names of the regulations that are up there. We had high tech. We had ACA, and now we have macro and MIPS coming. It's sort of complicated to figure out, but I encourage you all to figure it out because it's coming, and it's going to affect 93% of docs in America that take Medicare payments and all the organizations that employ them. So it's a big deal. It's the biggest change since the late 90s. And why is this happening? Because there's a projected increase of total healthcare spend in the United States from three and a little bit of trillion to $5.5 trillion. Those numbers are so big I can't really understand it, but I know that it's a great target for folks that are trying to build regulations and trying to change how we deliver care. So again, whether you like it or not, whether you believe in it or not, it's going to happen. 20% of the GDP is going to be a lot to spend on healthcare, and there's going to be a lot of people targeting those things that are expensive. Consumer expectations is something I don't have to spend any time telling you about. You all have smartphones. Many of you are looking at them now, and that's totally fine. We order Ubers, we order retail, we order travel, we do so many things, and then we get to healthcare, and it's sort of like hitting that emergency truck ramp on the highway. We all of a sudden slow down, and we are impatient. But as you see here, consumers are demanding better. Millennials are demanding better, and people are starting to respond. And then finally, clinical innovation. This is my favorite piece, because it really shows how the world is truly changing. When I trained, everything that was being done to a patient pretty much happened in a doctor's office or a hospital. And now we see organizations providing virtual care like Teladoc and Doctors on Demand. We see retail clinics like Minute Clinic, and we see a bunch of tech giants coming into the fray and really doing some cool things. Apple just picked up another couple companies in the last few weeks. We see concierge medicine like One Medical, and we see a whole bunch of other disruptors in the world. Our friends from AmSurg are here. They do outsourced surgery centers for colonoscopies. I have a favorite company that does outsourced labor and delivery called Baby and Me. keep an eye on them. They're pretty interesting. They're competing with the hospital labor and delivery wing. So all of these things are happening. All of their things are happening at the same time. And our thesis is, and what I'd propose to you as a family doc and someone from our company, is that the answer really is in focusing on the patient. It was funny, I was talking to Matt from Blackbird earlier, and he was saying that when he first started his company, people were asking him, what are you doing for CRM? And he said, I don't know, what is CRM? Customer Relationship Management Software, they said, and he started looking into it. He said, oh my God, it's so cool. You can actually like put things all around your customer and wrap everything around them, and you have a view of them from that point of view. That's really great. We should think about that. So that's what we do. We've been doing this for a long time. We've been in healthcare now since our beginnings, but we're really focusing on doing this around patients. And really not from a Salesforce perspective. I really hope to expose you to this other world if you haven't seen it already. This is the world where you really do focus on the patient, and it's not really a conceptual story. The conceptual story is important, obviously. The patient needs to connect to health professionals and the payers and their life sciences companies, the pharma and med device companies, and even the health and social service, the pharmacist, the grocery store, Meals on Wheels, the transportation folks. All of these people are now more and more part of the answer of how these folks get better. But there's a technology story here too. The platforms that are in most of the hospitals that we all enjoy don't do this. They don't extend outside of those four walls. They don't extend to devices. They don't extend to services or decision support tools that are out there. And so what's really important as you guys go forth and help change the world with me is to figure out how to connect those things to a patient data model, to an object that allows you to mirror the outside world in a way that the patients have been doing from the beginning of time. For the patient, they're integrating all these different sources. If you want a technology to be able to deliver those same kinds of results, you need to do the same thing. So how do we do it? Let's talk a little bit about this framework. This framework comes from the rest of our company. We've sort of found these 4 items are important in a number of different industries to solve a number of different problems. So let's go through them. The first is connect to people in a different way. The second is really mobility. This isn't quite a mobile device, but it sort of is. The third is building patient journeys or any kind of journeys, and the fourth is using intelligence. So what does it mean to connect with patients in a whole new way? So I love the Easter seals, and I love this picture especially because that kid with the extra eye sort of gives you a sense of what it's really like to be a kid with autism. Easter Seals treats kids with autism and other kinds of developmental disabilities, and they do this with 25,000 care coordinators and health professionals around the country. But 3,500 of them are in the Bay Area, and they recently went live with one of our products to do this exact problem. So if you take a kid with autism to Kaiser, the archetypal IDN, the organization that does everything themselves, they have an insurance company, they have hospitals, they have clinics. Even they don't treat autism by themselves, so they outsource this care to Easter Seals. Someone from Easter Seals shows up, does a behavioral assessment, an intellectual, cognitive assessment, works with the family, works with their colleagues, sends information back to Kaiser, sends information back to Easter Seals headquarters, does some billing, everyone's happy. But in the past, they were using paper. You guys can imagine. They were faxing the records to Kaiser. They were faxing the records to their headquarters. They were collaborating with people through all kinds of different modalities. Going forward, they're going to be using our product called the Health Cloud. They're going to be doing this online in the cloud. They're going to be building integrations to Kaiser, to their Athena Health EMR. They're going to be using mobile devices to reach out to the families. And they're going to be giving support to those family members and collaborating with their colleagues and peers. Again, it's one example of how Easter Seals, pretty much an ancillary care provider, is now helping to bring this whole ecosystem together and giving the support and the relationships that these families need. Another great part of this story is the mobility. I sort of alluded to it, but there's another use case. Here's another picture of kids. I love kids. So United Allergy develops allergy care, and they have these shots that people take all the time to desensitize them. It really works. The medicine works. But the problem is a lot of people don't like sticking themselves with these little needles, so they had this huge precipitous drop-off in people who use their care, use their medicines. And so what they did was they designed a little mobile device, a mobile app, and they gave it to these families and these people to use the medicine. It gives them support, it answers questions, it gives them a schedule, encouragement, all the kinds of things that you saw earlier today and that you're probably going to be seeing for the next couple of days. This stuff works, and what they noticed was a 1% increase in their renewals would pay for the entire program. That's a pretty big deal. And so again, I want to just connect back to the ROI and the financial incentives to do the right things. The third bubble is my favorite because I think it's the biggest opportunity for innovation. And this is the idea of journeys. Retail organizations, all kinds of folks in every segment of society, especially the ones that have had a really good monetary incentive, have thought about journeys, have thought about what it's like, what the experience is like for a consumer to go from naivete, not having any exposure to your organization, to being a loyal customer over many years and giving you some kind of longevity and value. Healthcare really doesn't think about that as much. We're starting to, which is cool. But we haven't really done it in as systematic a way, and we're starting to, which is great. One of the examples, and I heard their name come up earlier, is Weight Watchers. We all know Weight Watchers, sort of like all the things we've talked about earlier. These are organizations that we all know, and these are situations that we're all familiar with. When you first get in touch with Weight Watchers, they send you a series of emails. They send you a series of communications to try and get you on board. They continue to expose you to messages and to articles and to all kinds of things you need, communities of people and support to get the results that you want. It doesn't happen by accident. It doesn't happen because they beat you. It doesn't happen because they scare you. It happens because they give you support. They do this with some of the technology that we have, the idea of building a journey and figuring out what those nodes are. What are the nodes? What are the decision points when someone maybe stays on or falls off? I've heard it called the happy path. There are a lot of different names for it. But the pathways that people sort of travel through recovery, through cure, through maintenance of health doesn't happen by accident. It happens because people are smart about it and people pay attention to it. Weight Watchers is doing a great job with it. But I would challenge all of us to think about that and to start building those tools in. Finally, getting smarter. So I just saw a Gartner report the other day, and it was calling out machine learning as the biggest hype right now. It's currently at the top of the hype list. And so it's up to all of us to sort of push it along to the well-adopted list and accepted list. So the idea here is we've all been talking about big data and analytics for a long time. We've all talked about the value of predictive analytics and machine learning and deep learning and all those kinds of things. I think connected to journeys, it becomes important, but here's an illustration of it. You just saw a video about the Athena Breast Health Network. It's a pretty tremendous program. It was started by a woman named Laura Esserman, who's a surgeon, but she's also an MBA, and so she thinks a little bit differently than many of us, and actually is willing to subvert her own profession. She's willing to decrease the number of surgeries that she does. And here's how she did it. She realized that for a long time there was controversy around when women should be screened for breast cancer. Some organizations said 40 years old, some said 50. About a year ago, there was some kind of conclave, and they agreed that 45 years old was the right age. I'm a little skeptical. I think there's a lot more data that could be used to bring to bear on this, and the reason I think that is because I've been exposed to Laura and some of the work that she's done. So what she's done is she's taken family history and past medical history. She's built an algorithm to figure out who's at higher risk, who's at lower risk, and she uses it to guide screening. In her future form, she's going to start using genetic tests also. She hasn't been able to do this inside the Epic EMR. It's a little slow. It's a little heavy to do this kind of stuff with, too. And so she's used our company's technology to perform this. And it's really cool. What she does is she's building a huge study across all of the University of California campuses and a few other organizations. What you see on the left screen is a form that people use to fill out their information. They capture patient information in the middle, family history, past medical history, and then they're able to analyze this stuff using these data-driven patient insights. She's going to start using this to guide care, to guide some of the treatment protocols, and as you can imagine, every one of these folks is followed along a journey. So because Athena is using Salesforce, they're using actually all four of these modalities. They're connecting to their patients in a new way by bringing together data from a bunch of different systems, EMR systems and all kinds of other ones. They're bringing in mobility because people can fill out their questionnaires on any device. They're doing analytics, and they're building these journeys. And so imagine the combination of all of these things together and what it's enabling. Laura thinks that it can decrease the total number of costs, the total amount of cost that we spend for breast cancer mammograms, for screening alone, from $8 billion to $4 billion. Again, if you look at how much money is wasted in healthcare, it's a pretty good strategy to go after some of the waste. And some of the waste can be gotten after by doing some of these intelligent systems. So I'd really love to just end with showing you how we do it. And ideally, this isn't going to be that new. This isn't going to be that revolutionary for any of you. You can certainly look more and see more about Health Cloud later on. But the things that I wanted to bring out were the timeline that you can hopefully see. My monitor's a little faded, but hopefully you can see it a little better. The timeline on the left that shows how you can bring together information and look at it. This came from, I was really motivated to do this. I spent a lot of time in urgent care, and I was always afraid I was going to take care of a guy who'd been smoking for years and years and years, who came in with a cough every few weeks, and we wouldn't know that he'd come in for a cough for every few weeks unless we saw it on a timeline and we saw it visually. JAMA just came out with an editorial this week, I think, from a bunch of folks that were talking about the importance of visual displays of information, visual displays of this kind of thing, to make it really easy for docs to see, and nurses, and all kinds of folks to see what's happening. On the right side, you see something called a care map or a care team. These are the people on the right side that are inside an organization like a hospital. On the left side, crucially, people that are outside that organization. There are very few technologies out there in healthcare that really excel at bringing together various people from multiple organizations with data and collaboration and workflows to make it work. Now, we don't know healthcare like many of you do. Our specialty is connecting people and data and platforms. And so our goal here is not to own everything like some of the prior vendors that you've seen in history. Our goal really is to open it up. We've done it outside of healthcare. We're really hoping to do it in healthcare. We can only do it with you, or we can all do it together. So finally, we've got some demos showing in the Innovators Row right outside, so I encourage you to see it. Some of my favorite demos in history. We have this big user event called Dreamforce. Has anyone here ever been to Dreamforce? Awesome. Well, this year it's bigger than ever. U2 is going to be there. It's going to be a lot of fun, and I encourage you to see it. When I first got there, people warned me. They said, you have no idea what's in store. And I said, I've worked shows before. I've been to conventions. I've been to hymns. Is it like hymns? No, it's not like hymns. Thankfully. I love hymns, but this is really fun. This is really excellent. And then finally, please feel free to learn more about what we do. Come to our website. We've got tons of information, tons of demos, and we'd love to help you, and we'd love to help all of us make this whole world better. Thanks a lot.
Thank you.